The professional cycling team EF is on its last practice run before the Paris-Roubaix, the toughest one-day race of the season. Since 2013, they've been racing it without the help of a powerful drug that many cyclists have depended on for years.
We really wanted to get rid of it in our team across the board during competition. To hear, athletes who have used it in the past, one of the first things they always say is, I can't imagine having to react quickly on this medication.
The drug is Tramadol, an opioid painkiller like Oxycontin. And as of March, the Cycling Federation has followed EF's lead by banning it in all international races. But for years, Tramadol wasn't marketed as an opioid at all, because doctors said it wasn't addictive.
Even though we were told there was no addictive potential, there was addictive potential. We were told there was none of the real downsides of opioids, yet we were seeing these downsides in hospital settings, in clinical settings. What I see is the emergency room is part of the bigger opioid problem that we have in the United States.
Better known under the US brand name Ultram, the DEA increased its regulation of Tramadol in 2014. But its classification is so low because of its perception as a weak opioid that a prescription can be refilled multiple times.
You can imagine that, if you're a patient and you've just gotten your hip operated on.
In a research study published in May with her team at the Mayo Clinic, Dr. Molly Jeffrey proved what sport doctors like Sprouse had suspected for years.
We wanted to compare if you get Tramadol versus if you get other short-acting opioids like hydrocodone or oxycodone, are you more or less likely to continue using? And because there's this idea that it's a weak opioid and therefore not as addictive, we had thought that we might see that people were more likely to discontinue it.
That wasn't the case?
It wasn't the case at all. People were just as likely to continue using Tramadol, if not slightly more likely.
Worse, many doctors prescribe it thinking it is less addictive than stronger drugs.
You definitely see some people, some clinicians who think it's not an opioid and therefore tell their patients, this is Tramadol and it's not an opioid. They were taught in medical school that it wasn't an opioid, and so that's what they tell their patients too.
That's what happened to Andrew. He's been in rehab for 3 months. His addiction to opioids began 9 years ago when he was prescribed Tramadol as a soldier in the US Army.
They passed out Tramadol for any number of reasons. If somebody had a sprained ankle, they would get a bottle of Tramadol and be able to keep it in their rucksack, and that it just managed to find its way through the company very quickly. It spread like wildfire.
When did you first start to notice some kind of dependence?
I noticed some level of dependence almost instantly. Made me feel comfortable with snorting an unknown white substance. And that led to, I used cocaine, I snorted methamphetamine. And that all happened within 9-10 months of me trying Tramadol in the first place.
Back on the professional cycling circuit, the Tramadol dope testing campaign is in full swing.
To put the label on, because there's no name on it, because the lab doesn't know which is the name of the athlete. And later, to lab.
Addictive qui est programmé d'ici 55 minutes. Voilà le début des hostilités, cette longue épopée qui va les mener.
So far, the cycling community is the only one to have taken a real stance against the drug.
This is a race where there would be some pressure to use a painkiller like an opioid. And within about 10 meters of being on the cobbles, you just want to be off. It's long, and then you're hit with these painful, violent sections. But I would say it's absolutely one of the hardest, if not the epitome of it.
So is he 18 seconds back? Yeah. He's group 2 now?
Sprouse and others hope the World Anti-Doping Agency, or WADA, will follow their lead.
But Gilbert is going to score for Belgium.
Other sports haven't taken this step yet. So we're definitely in the forefront, but I think there's more to be done.
Belgium, he has won Paris-Roubaix, and that for him is a major, major deal.